Critical colon cancer symptoms you should never ignore. Hello and welcome to this video on colon cancer. Colon cancer is a type of cancer that starts in the large intestine, also known as the colon. It is one of the most common cancers worldwide, affecting more than 1.8 million people every year. Colon cancer can cause serious complications such as bleeding, blockage, and spread to other organs. However, it can also be prevented and treated if detected early. In this video, we will learn about the causes, symptoms, diagnosis, treatment, and prevention of colon cancer. Risk factors and causes of colon cancer. The exact cause of colon cancer is not known, but certain factors can make it more likely to occur. Some of these factors are older age. Colon cancer can happen at any age, but most people with colon cancer are older than 50. The numbers of people younger than 50 who have colon cancer has been growing. Doctors don't know why. Black race. Black people in the United States have a greater risk of colon cancer than do people of other races. A personal history of colorectal cancer or polyps. Having had colon cancer or colon polyps increases the risk of colon cancer. A polyp is a small growth of tissue that may or may not be cancerous. Inflammatory bowel diseases. Conditions that cause pain and swelling of the intestines, called inflammatory bowel diseases, can increase the risk of colon cancer. These include ulcerative colitis and Crohn's disease. Diet. Eating a lot of red meat or processed meat, such as bacon, sausage, or hot dogs, can increase the risk of colon cancer. Eating too little fiber from fruits, vegetables, and whole grains can also increase the risk. Smoking. Smoking cigarettes can damage the DNA of cells in the colon and make them more likely to become cancerous. Alcohol. Drinking too much alcohol can increase the risk of colon cancer by affecting how the body breaks down and uses nutrients. Warning signs and symptoms of colon cancer. The signs and symptoms of colon cancer can vary, and some people may not experience any symptoms in the early stages. However, common signs and symptoms to watch for include 1. Changes in bowel habits. This can include diarrhea, constipation, or a change in the consistency of your stool that lasts for more than a few days. 2. Blood in stool. This may appear as bright red or very dark blood in your stool, or you might notice blood on toilet tissue. 3. Abdominal discomfort. You may experience persistent abdominal pain, cramps, or discomfort, especially if it's associated with a change in bowel habits. 4. Unexplained weight loss. If you're losing weight without trying, it could be a sign of colon cancer. 5. Fatigue. Unexplained fatigue, weakness, or a general feeling of being unwell can be a symptom. 6. Incomplete emptying of the bowels. Feeling like you can't completely empty your bowels can be a sign. 7. Narrow stools. Stools that are narrower than usual can be a concern. It's important to note that these symptoms can also be caused by conditions other than colon cancer. If you experience any of these symptoms, especially if they persist or worsen, it's crucial to consult a healthcare professional for evaluation and appropriate testing, such as a colonoscopy, to determine the cause. Early detection is key in the treatment of colon cancer. How to diagnose colon cancer. To diagnose colon cancer, your doctor will ask you about your medical history, symptoms, and risk factors. They will also perform a physical exam to check for any signs of colon cancer, such as a lump or tenderness in the abdomen. They may also order some blood tests to check for anemia or other abnormalities. However, the most definitive way to diagnose colon cancer is by looking inside the colon using a procedure called a colonoscopy. A colonoscopy involves inserting a thin, flexible tube with a camera and a light at the end through the anus and into the colon. The camera allows the doctor to see any polyps or tumors that may be present in the colon. If the doctor finds any suspicious areas in the colon, they will take a small sample of tissue called a biopsy and send it to a laboratory for analysis. The biopsy can confirm whether the tissue is cancerous or not. Sometimes, the doctor may also use other imaging tests, such as X-rays, CT scans, MRI scans, or PET scans to see if the cancer has spread to other parts of the body. Treatment options for colon cancer. The treatment options for colon cancer depend on the stage of the cancer, the location of the tumor, and the overall health and preferences of the patient. Some of the common treatment options are surgery. This is the main treatment for most colon cancers. It involves removing the part of the colon that has the cancer and some nearby tissue and lymph nodes. Surgery can be done through a large incision, open surgery, or through several small incisions, laparoscopic surgery. Sometimes, surgery can also be done through a colonoscope, local excision, if the cancer is very small and in a polyp. Surgery may also involve creating an opening in the abdomen, colostomy, to allow waste to leave the body if the colon cannot be reconnected. Chemotherapy. This is the use of drugs to kill cancer cells or stop them from growing. Chemotherapy can be given before surgery, neoadjuvant chemotherapy, to shrink the tumor and make it easier to remove, or after surgery, adjuvant chemotherapy, to lower the risk of the cancer coming back. Chemotherapy can also be used to treat advanced or metastatic colon cancer that has spread to other parts of the body. Radiation therapy. This is the use of high-energy rays or particles to destroy cancer cells or slow their growth. Radiation therapy is not used very often for colon cancer, but it may be used before surgery to shrink the tumor, after surgery to kill any remaining cancer cells, or to relieve symptoms such as pain or bleeding in advanced or metastatic colon cancer. Targeted therapy. This is the use of drugs that target specific features of cancer cells, such as proteins or genes that help them grow and survive. Targeted therapy can be used alone or in combination with chemotherapy to treat advanced or metastatic colon cancer that has certain gene mutations or markers. Immunotherapy. This is the use of drugs that help the body's immune system recognize and attack cancer cells. Immunotherapy can be used to treat advanced or metastatic colon cancer that has certain gene mutations or markers and has not responded to other treatments. The best way to prevent colon cancer. Colon cancer can be prevented or detected early by following these steps. Screening. This is the process of checking for cancer or precancerous polyps in people who have no symptoms. Screening can help find colon cancer at an early stage when it is easier to treat and cure. Screening can also prevent colon cancer by removing polyps before they become cancerous. There are different types of screening tests for colon cancer, such as stool tests, sigmoidoscopy, colonoscopy, and CT colonography. The type and frequency of screening depends on your age, risk factors, and personal preference. You should talk to your doctor about the best screening option for you. Lifestyle changes. This involves making healthy choices that can lower your risk of colon cancer. Some of these choices are eating a balanced diet that is high in fiber and low in red meat and processed meat, being physically active and maintaining a healthy weight, quitting smoking and limiting alcohol intake, managing chronic conditions such as diabetes, high blood pressure, and high cholesterol, medication. This involves taking drugs that can reduce the risk of colon cancer in some people who have a high risk due to genetic factors or previous polyps. These drugs include aspirin, nonsteroidal anti-inflammatory drugs, NSAIDs, and hormone therapy. However, these drugs may also have side effects and interactions with other medications. You should consult your doctor before taking any medication for colon cancer prevention. Conclusion. In this video, we have learned about what colon cancer is, what causes it, what symptoms it may cause, how it is diagnosed, how it is treated, and how it can be prevented. Colon cancer is a serious disease that can affect anyone, but it can also be prevented and cured if detected early. That is why it is important to be aware of the risk factors and symptoms of colon cancer and to get screened regularly according to your doctor's recommendations. If you found this video helpful, please like, comment, subscribe, and share it with your friends and family. Thank you for watching and stay healthy.